안녕하세요.
Greetings, I'm Professor Park Chang-ju of Hanyang Dental Hospital Oral Maxillofacial Department. It's my pleasure to present on online surgery lecture once again. In today's case, I'm going to talk about the freshly renewed OneCAS Kit. This patient is 57 years old, male patient, and number 27 is missing. What is shown foggy here is a CT checker where you put it on the template to look at the position and final depths. The residual bone is not significant, so crestal approach was selected. I'm going to use the new OneCAS Kit. This is the result of virtual study. On the plan, approximately around the fixture, the lowest alveolar bone height is around 4.56 and the area with the most alveolar bone is around 6.64. I'm going to place implant fixture 4.5 by 8.5 and I'm going to detach the Schneiderian membrane, do the lift and bone graft together via crestal or transcrestal approach. There are a few things to note in this surgery. The renewed OneCAS Kit, without removing the template, you can do hydraulic lift and bone graft without removing the template. Personally, I prefer removing it first and then doing lifting and grafting. However, in a case where multiple teeth are involved, template would be fixed and you would not be able to remove it. At times, you need to do lifting and grafting with the template on. With the renewed OneCAS Kit, you can do this easily. Please remember, and this is post-op result. A fixture has been placed. It was placed slightly deeply. Healing abutment was connected. And bone graft material is looking slightly foggy. With crestal approach, you cannot accurately define the amount and position of bone graft. There are a lot of cases where the bone graft material looks foggy around the apex of the implant. Personally, I don't think this is a problem. Let's look at CT. Pre-op mesiodistal and pre-op buccal palatal, and this is post-op mesiodistal and buccal palatal. Around the Schneiderian membrane, lift and bone graft has been done nicely. The key points in online surgery. First, please look at the renewed OneCAS Kit. Second, the template is not going to be removed as I do sinus lifting and grafting. Third, I'm going to use collagenated bone graft material rather than particulated bone graft material. And this is the recent trend in bone graft. Let's look at the surgery. Thank you.
감사합니다.